Does having Vista outcomes, how does that help your work in getting people through audits and avoiding audits in the first place?
I think tracking outcomes is essential. It's not only essential for a payer audit, it's essential for payer negotiation. I mean, if we're talking about just revenue cycle, it's essential for the facility to know if they're doing a good job so that they can have a culture of continuous improvement so that they can continue to deliver better and better clinical outcomes. That aside, from a revenue cycle standpoint, I think it's imperative in an audit situation because we can say, hey, listen, this is a good treatment provider. They are doing good work. Or look at the last 5 years. They've been investing in order to improve their work. So, they had X% satisfaction in 2023, Y% satisfaction in 2024, or, whatever it might be. We actually, in this letter, included the Vista Research report and a summary of the findings as part of our appeal and sent that to the Department of Managed Healthcare. We said not only do they embrace a culture of continuous improvement, but they're going above and beyond and they're investing in it. They're paying for it. They're not doing it themselves. Even if they were doing it themselves, that's still helpful, but it's much more helpful when we can show they're using a third party where there's no bias and it's being benchmarked against other treatment programs. And we were able to show that these are the good guys. These are the types of people that you want in your network, that you want in your community. You want the ones that are investing in tracking their own work and their own performance so that they can get better and better at their jobs and that they can stay mission aligned, which is helping people get recovery.
So
but we also use it for payer negotiations, just FYI. So, we can show really good outcomes, clinical outcomes. It reduces the lifetime spend that the payer needs to spend on that member. And that allows for us to negotiate better rates with the insurance companies. So, we want to be able to show not clinical outcomes just for a while the person is in treatment, but post-discharge clinical outcomes is really when the rubber meets the road. We want to show that they are no longer a burden to society through jails and other institutions. We want to show that there aren't any emergency room visits. We want to show that they're not overdosing and landing in the ICU and that they are not, that the insurance companies are thinking about it from a cost standpoint. If we can show those things, then we can do better negotiations, improve the actual rate. But we're also now moving in a direction of value-based care where we can negotiate case rates. We can negotiate longer lengths of stay. We can negotiate things like that based on clinical outcomes. So outcomes are essential all the way around.